Over to you.
Okay, well, thank you. And let me start by telling you that I have been able to participate up to this point through the webcast and follow the conversation. So it's just been really inspiring and energizing up to this point. I want to start with a statement of gratitude, really, to George and David for their willingness to co-chair this incredibly important work. And thank you for allowing me to join this, what sounds like a energized but small band of kindred spirits in the room. I would underscore the comments about the urgency, the importance, and the magnitude of the problem, as well as the need for action. So I'm clearly aligned to many of the comments that have started us off here today, and appreciate those. Can you go to slide 2 on my slides, please? I framed my comments for today under these perspectives on the path forward in terms of some reflections on the paper that we all received in our package on the environmental scan, as well as the vision that was shared with us this morning and for this roundtable. But proceeding from some quick reflections on those to what I think might be some opportunities for us to really promote action, and emphasizing that interest in getting action, and what are some positive forces that are out there we might be able to harness and bring into our fold, as well as some of the challenges and gaps that we'll have in terms of mobilizing our partners. And in closing comments, I will share some particular comments from myself as an employer, a non-healthcare employer, and our experience to date in doing this. So move on to the next slide. Referencing the environmental scan, certainly a really wonderful paper that was are there some comments in the room? Are we following okay?
Yeah, we're doing good. We're doing fine.
Okay. Provided us with some important framework on definitions and conceptual framework, and their own assessment of challenges and opportunities, along with some recommendations. And as we move to the next slide, reflections on this environmental scan, I thought that it was very helpful and a good place to start, but similar to the comments made by Harvey and Steve already, we've got a long way to go. In that, one of the questions that I was reflecting on as reading some of these materials is, we have to wrestle with, why are we not there already? We're sort of talking about a destination of total population health, and it seems so logical, seems like such a, who would be against this? But why are we not there? And how will we build the will for change? Because we're going to have to overcome some serious momentum and inertia around that change. And who's going to lead this? Similar to the comments from Harvey, how are we going to bring others with us on this journey? I'm reminded of some comments made by the World Economic Forum as they grappled with the magnitude and the significance of the challenges here on health. And their summary statement was that it would require the mobilization of broad social forces in order to really move us to a new state of being. And how are we going to get there with this challenge? Please move to the next slide. Reflections on the draft vision. Some really powerful elements captured here, and I've highlighted and noted some of those in terms of identifying opportunities, catalyzing the high performance multi-sectoral health system, having the evidence base, and Steve was referencing that some places it's out there and some places it's a little bit thin, as well as figuring out what are those doable goals and those things that can bring us success both in the short term and beyond the trajectory to the destination we see and the plan for the long term. But the last couple of bullets here are my additions to the thoughts that are already captured in this draft vision, and that I think building will and creating the value case is going to figure prominently in our ability to be successful. Creating potentially the economic case in broad societal terms that will compel these other aspects of the multi-sectoral collaboration that's needed to make this their own objective, rather than trying to twist their arms and cajole them into joining with us on this journey. And there's also a significant need for and a benefit of defining frameworks at the community societal level that will facilitate and enable this type of multi-sectoral collaboration and effort, and some ways that it's effective to convene these groups. It's not a process that exists today in broad scale, and those processes need to be created or framed to allow that to happen, and the systems need to be linked up. There was a lot of effort in describing the fact that we have this duality, the healthcare system and the public health system, in the environmental scan paper. Well, how are we going to get those together? And there's a real need to figure out some mechanisms of convening those parties. And then the professionals that are involved, even those that become inspired and motivated around this vision, don't necessarily have the skills and competencies to act in this new way. And I'll make some further remarks on that as we talk about the positive action. But I think we need to harness and integrate those existing efforts. I'm all for expediency and finding those paths that are as proximate to us that will help us move in the direction we want to move. And if we go to the next slide, opportunities for action. Thinking about what's happening in our environment already today that have some traction and some momentum that are at least related to the intent of creating total population health. We've certainly seen a lot of focus and discussion on the triple aim, or the three-part aim, of which population health is one of those core elements, and how can we capture the energy that's around that and the focus of many parties in the healthcare system in that reign to bring the right vision around that piece that's population health. We have a lot of emphasis on this patient-centered medical home, or the patient-centered neighborhood. And within that core elements, there's also references to population health, but really creating the vision for that and helping to figure out, well, how are those medical home practices going to be able to successfully be agents of driving improved population health within their communities. Accountable care organizations, which in some theory are moving us away from the fee-for-service payment as well as other types of payment reform, and finding ways that we can integrate into those efforts that they become part of this solution space. The IRS rules for hospitals and their nonprofit status on community needs assessment and community benefit, and connecting in that such that we can drive the agenda around population health more successfully through those. You know, the fascinating descriptions that are out there of the blue zones and the efforts to replicate blue zone communities which are focused on population health. Certainly the wonderful work that David has been leading, and the Robert Wood Johnson around county health rankings and the roadmaps to health, and finding more ways to disseminate that and build and grow. The recognition of these imperatives around collaboration as brought up by the World Economic Forum and placed before the business community of the importance of addressing non-communicable diseases as a major threat to their long-term success. In the sustainability journey and lexicon that's out there, and building health into that effort. I just last week participated in a forum at the Harvard School of Public Health was hosting about creating and expanding this concept of a corporate handprint, of getting the business community to, as part of their sustainability efforts, to look at how they are becoming agents of delivering positive change in the community, and one of those aspects being health. We are getting some capacity to have the evidence base through the Guide to Community Health and the roadmaps work. So that's a great start to build on. And the examples of communities that have moved in this direction, as well as the fact that we're beginning to see the business case for employers to think about not just their own populations, but how those populations within the communities where they operate will draw them into this community action. Next slide. Recognizing that this is not going to be a simple or an easy task, and that there are sort of wins that are out there that will be a challenge for us to make progress. I've mentioned the lack of organizing frameworks, the void in skills and knowledge among professionals. I mean, even those health systems today that say, well, we need to be able to manage population health, quite readily are frequently admitting that they really don't have that as their skill set, and they haven't had their specific business plans focused in that way, and they're going to need some new capabilities to move. So many anchors from the legacy that we're dealing with today, and the desperate needs for translation of those best practice examples where we have those communities who have made significant progress. And in just about every field, but particularly in health, dissemination of the evidence base is a continuing challenge. I was imagining sort of this Dartmouth Atlas of population health, where we really continue to have the ability to identify both communities of strength and those with challenge, and making sense of the measures. It's, you know, there are measures out there, and there's a lot of measures out there, but they are done on different population groups, and even it's hard at the community level to feel like you've got consistent measures that are looking at the same populations. But the main call is we've got to actually do something. And with all the work of the roundtable, thinking about constantly implementation implementation. How is this going to really get done? So moving to some closing comments at this point. I think there's incredible value in this work, and I'm thrilled to be part of this roundtable. Great reasons for optimism. I agree with the opening comments from David that the timing is good. But we have all recognized our need for perseverance and not to underestimate the challenge. On this comment of metrics, just to sort of illustrate what I'm looking at today in the real world, trying to do this work at the level of the community, we have the great privilege of having the county health rankings, which are measures at the county level. We are using the Commonwealth data, which is through a hospital referral region base, which is a different way of categorizing populations. And then we look at the Gallup Wellbeing Index, which in fact is, by congressional district. So coming from Dow, we've had a health strategy in place for many years, and several years ago, about 5 years ago, decided that part of our strategy needed to focus on community and began to do that work, but ran into many of these challenges that we'll face in this group of, well, what's the framework to do this kind of work? How do you bring people along on this journey? And I think my time is up, so I need to stop here at the last slide and say thank you for the opportunity to share these comments and to be part of this work.
Cathy, thanks so much for that. And actually, for this section of these presenters, we were going to save most of the comments and questions until after everybody's done because they hopefully overlap and synergize. But Cathy, I wasn't sure if you're able to stay with us for the rest of the morning. And if not, we could take a question or two for you now.
I will be able to stay with you. Because I need to switch back to the webcast, what might work is if you had questions when you get to that point, maybe if Alina, you could just call me on the phone and I'll join questions by phone.
Okay, or we could take one or two now if anybody.
Happy to take them now as well.
Yes, anybody has a particular question for Cathy in case we don't get to it at the end? Oh, yes, we have one.
Hi, Cathy. Mary Pittman from the Public Health Institute. Thank you.
Can't hear you, Mary. Would you speak a little?
Yeah.
Yes.
How's that? Hi, Cathy. Good morning. Mary Pittman from the Public Health Institute. Appreciate your presentation. And you ended by saying that Dow had come up with a community strategy. Can you tell us a little bit more about that and how you see that perhaps contributing to the leadership in the corporate sector?
Yes, we recognized that within our health strategy and the objectives we had, which are pretty much the triple aim, better health, better value for our dollar spend, and better care for our people, that in order for us to really be successful, we would have to move into the community and that would wrap in our spouses, dependents, retirees, and populations that aren't inside the company's walls, and that it would also recognize the fact that we alone are not going to be able to be successful. We needed to engage these multiple sector partners. This would help us address the culture of the community, the built environment, whatever. And we've looked at what's the value case for doing that, and I think that our journey might be informative to the group of understanding how participating in that will help us with our multiple corporate objectives in terms of economics, safety, having our human capital expertise in terms of being able to attract and retain the world-class talent that we want. Being in a community of health excellence matters to those kinds of objectives, and looking at how this helps us address these multiple priorities. And we have been doing this in a 14-county region around our corporate headquarters as a trial now for 5 years, and are starting to see some impact of that effort at the community level.
Okay, thank you. Any other questions or comments now? Okay, thanks, Cathy. We'll, if we have others that come up later on, we'll try to reach you via other technology and put those questions into the discussion then. Okay. What we tried to do in this morning was to organize a series of different perspectives on the broad question that's facing us, and sort of setting up us to be thinking about our vision and those pressure points that we can work on as a roundtable, going forward. So we're moving along through various perspectives, and next I'm going to call on Eduardo Sanchez, who is currently Deputy Chief Medical Officer at the American Heart Association. Most recently, that's a new position. Most recently, he's been Vice President and Chief Medical Officer for Blue Cross Blue Shield of Texas, and prior to that, served as the Texas Commissioner of Health from a period from 2001 to 2006. And we look forward to your perspectives on our challenge.